Hello, hi, good afternoon, and good evening might be in some part of the world. Just to make sure that if I'm clearly audible and you can see my screen so that we can start up with the session, if anyone can comment or just open your mic and let me know that I'm clearly audible. Perfect. So I'm Zahid. I'm one of the mentor with MedPrep Online. I'm working in NHS UK. I'm a pediatric trainee, and I'm excelling my career to become a CCT consultant soon, hopefully. My field of interest is neonatology, and I will be applying for my grade training next year, hopefully to become a neonatologist. Finger crossed. Let's see how the things goes on. The today's session we are arranging is about introduction to MRCPCH clinical because there is a lot of confusion going around. You keep on asking the question that how MRCPCH exam is like, how many stations there are, whether there is patient in the clinical exam or not, what about the development station. So just to make the things clear for everyone, we arrange this session. Uh, it will be a question and answering session. Everyone is free to ask any question. If you have any doubt regarding MRCPCH clinical exam, I'm here to answer your question. Any kind of worry regarding the exam, I'm here to answer. We will walk through the slides one by one. If you have any question in between, you are free to ask any question. You can open your mic, you can ask the question, you can write the message, and I am here to answer your question. If in case by any chance I'm not able to answer the question, I would like to look for it around in the internet. I will search it and I will get back to you through the WhatsApp message or through the MedPrep people, and they will communicate the answer to you. The video recording will be available as well for this session, but I would recommend to join till end so that if you have any question and you want to clarify that, it will be easy to clarify that in online session rather than watching the video later on. So to kick off with the session, if you guys have any question before we start and while waiting for others, you can pop up that in the chat box, and I will keep on answering that while I go through the slides. So MRCPCH exam, every person have their own perspective that why they are taking MRCPCH exam. Just 1 second. Today's is not for me. Yeah. So every person has their own perspective that why they want to take MRCPCH exam. Uh, I took it basically to come to the UK and to become a consultant here to progress my career. Some people might be having same aim of coming to UK and continue here, working in NHS and start training and become a consultant. Then some people might have the objective that they want an extra degree to write with their name so that they can, if they are doing private practice, they will attract more patients. If you are working in Gulf country, so after 3 years of MRCPCH, you can work as a registrar or you can work as a specialist in UAE. But in Saudi, I believe it's 2 years. So every person has their own perspective of taking MRCPCH exam. Some people might take it for fun. I know a lot of people who just get bored at home, sitting at home, and they like taking different exam just to keep themselves up to date with the knowledge. Because once you are taking an exam, you keep on reading around the topic and around the pediatric, and it keep you up to date. So MRCP says basically is to provide a globally recognized credential, enhancing career prospect and opportunities for professional advancement. Apart from coming to UK and working here in NHS, you can work in Australia. It is recognized in Australia. It is recognized in most of the Gulf country. Without a CCT, if you have MRCPCH, you can work up to a specialist. But if you come to UK and you apply for training and you get the training, then you can become a consultant as well. So to have a consultant label to you, you need to have MRCPCH with a CCT. The exam rigorously assesses clinical skills, ensuring the candidates are well prepared to deliver high quality pediatric care. The structure and comprehensive nature of MRCPCH exam promotes a deep understanding of various pediatric conditions, fostering a holistic approach to child health care. Passing the MRCPCH exam instills confidence and a sense of achievement, motivating pediatric to continue their lifelong learning and commitment and excellence in their field. Yes, so someone has asked a question. Let me see. Yeah. So doctor has asked a question. I will be coming to this thing. This is the most important thing because MRCPCH clinical is not like theory. Theory, the booking open and as long the seats are available, you can book a seat for you and you can give the MRCPCH theory exam in a planned manner. But things are different for MRCPCH clinical. You cannot plan for MRCPCH clinical properly because of the seating criteria, and that we will be discussing in a couple of slides. So, like someone asked about the how to apply and when to apply and what about seating criteria. So problem with MRCPCH clinical, once you are done with all theory papers, you are eligible to sit in MRCPCH clinical exam. There is no specific pattern of passing the theory papers. You can pass AKP first, followed by FOP and TAS, or you can take a FOP and TAS together, followed by AKP. So there is no specific pattern of taking any of the theory paper, but once you are done with all the theory papers and then only you will be eligible for the MRCPCH clinical. And that's the most tough part because you keep on applying for MRCPCH clinical exam and every time you keep on applying you get rejection because the seats are limited. In a day they like there are two sessions in a day. In one session there are 14 candidates and in one day they sorry 12 and 12, yeah, so 24 candidates in a day and the exam run for 2 days, so hardly in one session they one diet or one session in one country they accommodate 48 students. So looking at the passing percentage of the pair candidates who pass the theory and then come to clinical, uh, the theory percentage is quite higher as compared to the availability of clinical seats. So you keep on getting the rejection and that make you disheartened. But I would recommend that once you are done with all the theory part, don't dishearten. Keep on applying because that's the only thing you can do. You cannot change the system because it's the system which is going on. So for preparing for MRCPCH clinical exam, you need to have a strategic and thorough approach. Begin by familiarizing yourself with the exam format and key competencies assessed, such as communication skill, clinical examination technique, and decision-making abilities. The problem is once the people who are applying from outside of UK, the big challenge which we face is the communication and history taking. When I was preparing for my exam, I thought that it's all drama, but since I have come to UK, I have seen that this is a routine thing what is done here. Patients wait in the emergency for 8 hours, and when they come inside, we hardly talk to them for 30 or 40 minutes. It's all communication. In the end, they go home without taking a single thing from us. We are not doing any investigation for them unless and until it's clearly indicated. We are not giving any medicine. The most we are doing them telling them you can take paracetamol, or you can take ibuprofen, and all these medicine are available over the counter. So communication and history techniques are the most challenging things which our candidates who are appearing from other part of the world who are not practicing in UK, there's the most challenging. So once you are done with the MRCPCH theory part, I would strongly recommend familiarize yourself with the communication skill and history taking technique. You can use a variety of study resources. These are textbooks which are mostly outdated. Like the Mark VT was one of the textbook recommended, but it is quite outdated. It's not been there is no new publication of that, so you can still refer to it for reference purpose, but I would recommend to go through online resources like there's patient info. If you go to patient info, you can find quite a lot of useful resources. If you write a topic like, for example, asthma in Google, followed by patient info, so you will get two different kind of article. That will be professional article and that will be a patient leaflet. So Referring to the professional article, you can follow that article for preparing for your history, and referring to the patient leaflet, you can follow that for communication. Patient information, patient info is written quite beautifully in the way that it's in the same pattern it's written when the examiner will ask take the viva from you, and the sign and symptoms, they are written in the way that you need to cover when you are asking history question from the role player or the mother or the father, whoever is with you in the history session. So I strongly recommend going through the patient info rather than the textbook, because they are not outdated. And if you see the patient info, if you search for any topic and it pops up in front of you, you can see that when the article was last updated. So if it is more than 3 years that the article is not updated, it will show you that the article has been outdated and it's not recommended to be read. But it's still better than the textbook, which have been renew like couple of years back. So if in case any article which is not renewed in the last 3 to 4 years, it will be popping up to you that this article is outdated, but it's still applicable. You can still read it. Uh, while you are waiting for MRCPCH clinical, I strongly recommend to join large groups initially. See how people are doing communication, how people are doing history station, how people are doing video station, to have an idea of the exam, because there will be people who will be preparing from the for who there will be people who will be going to appear in the exam, so you will have an idea how the things are going on with the communication, how things are going on with the history, and how the things are going on with the video station. But once you are near to the exam, I would recommend take make a small group, at least a maximum of 3 to 4 people. If you have one good partner, that is more than enough. But problem is everyone is working and everyone has a strict schedule, and we have to continue working, preparing for MRCPCH clinical with our work schedule. We cannot take time off completely sitting at home. It's very difficult, especially if you have responsibility, like you have family, you have kids. So then it's become difficult that you take complete time off your work and study for MRCPCH, and it is not recommended as well, because the more you will be in touch with the clinical, the more easy it will be for you to pass MRCPCH. So in the initial stages, you can refer to large groups in which people are practicing. You can just see them how they are studying, how they are doing communication, just to have an idea of the communication skill and the history. Once you are going near to the exam, or you think that in the next couple of months you are going to get a seat, then I would recommend to make small groups. The 3 or 4 is max number for a small group. The reason to have 3 or 4 candidates is that if in case one is busy, you will have some alternative person with you to practice. There is no definitive number of hours which someone would recommend that you need to study daily, because every person has different background. So as I mentioned, engage in regular practice session with peers or mentors to stimulate exam condition and receive constructive feedbacks. Uh, Time management skill and staying updated with the latest pediatric guideline and research will boost your confidence and readiness for the exam. One more thing, when you start practicing with your own small group, try to practice with time. Uh, Time yourself and see how you are doing with the communication, how you are doing with the video station, how you are doing with the history, because in the exam, time management is the most important thing. You need to know that you are finishing the things in time. We can take history if a patient is coming to us in the emergency. Sometimes we spend with them 30 and 40 minutes just taking the history from them. Sometimes if I ask an open question from the mom or the father, whoever is bringing the patient to me, that what brought you here today, so literally they keep on talking for at least 10 minutes. So just a question popped in. So Dr. Avinash, if you go to the Google and just write, for example, any topic, for example, asthma, and then after that write patient info like this. Let me write in. If you search in this way in the Google, so it will give you the topic list. It will be from the patient info, in which there will be two kind of article. It will be related to the professionals, which is written for doctors, and it will be a patient leaflet, which is written for the patients in layman terminology, which they are usually following. So the professional article you can follow for preparation for your history, and the layman or the leaflet you can follow for communication. Or if you, for example, cystic fibrosis, So if in this way you keep on searching the topic in the Google, just go to the Google and type patient info, type cystic fibrosis space patient info. It will take you to the website, and you can read the topic from there. I hope it's clear. Welcome. So MRCPCH clinical is not a journey of month or two. It is a several months journey you have to start. The first challenging thing you face is availability of seat. Once you get seat, then the second step is to give the exam well prepared. The problem is while waiting for the seat. So I mentioned patient info. I will give you the link in the end as well. No problem. I have left some links in the end of the session. So if there is still any problem with searching the topic, I will give you links to the websites. So once you get the place for the exam, you have hardly 2 months in which you have to just polish your skills. So once you pass your theory exam, there are two options: either sit for a couple of months and relax, and once you pass some period of time, then you start applying. Other option is you start preparing slowly and gradually. You have communication, you have history, you have video, you have clinical, you have development. So start familiarizing yourself with the stations and then start preparing, reading the leaflets. I recommend starting with reading the leaflet. It will give you an idea that how you can use the layman terminology, avoiding the jargons. Most of the people, they used to ask that how much time I need to pass, how much time I need to study, how many months I need to study, how many hours I need to study. That's the most difficult question to answer, because every person is different, every person comes from a different background, every person has different level of training. Some people might start their journey to appear in MRCPCH clinical exam soon after they are done with their house job or their internship. Some people might be in the middle of their training, who are quite fresh with a lot of knowledge. Some people might have finished their MRCP, their basic home training, and they might have got the degree as well, and they're doing MRCPCH clinical exam. So MRCPCH or MRCPCH clinical exam. So that's the most difficult question which people used to ask, and there is no definitive answer to that. Second thing, MRCPCH clinical exam is not about knowledge. I always used to say it's about how safe you are as a registrar. MRCPCH clinical exam is the only exam which is taken by the by the UK trainee who are doing pediatric training, starting from the basic when they start from ST1 till the ST7. This is the only exam they have to take. They usually take part one, 4 pentas in ST1 in the first year, followed by AKP and ST in the second year. But now the things are changed. Previously, they used to have training years of 8 years, which has been changed to 7 years now. So previously, they were required to finish their MRCPCH clinical exam by year 3 or ST3, but now they can go up to year 4 to pass their MRCPCH exam. So this is the only exam they take to become a consultant, starting from the very scratch without any knowledge of anything. Like usually they do foundation year 1 and 2, which is equivalent to our house job which we do. But after their foundation, they apply for their training if they are coming to pediatrics. So they start with ST1 with the first year, and then in 3 years or 4 years, they pass their MRCPCH clinical exam. Then 5, 6, 7, either if they are interested in doing some subspecialty, they go to the subspecialty, or if they want to continue with the general pediatric, they continue with the general pediatric. And by the end of year 7, they become a consultant. So if they have interest in general pediatric, they will continue to be a general pediatrician. But if they have interest in some subspecialty, so they will go and become a subspecialty like a neonatologist or a pediatric respiratory consultant or gastroenterologist, or whatever field they have chosen. So this is the only exam which candidates take in UK. So initial assessment begin by assessing your current knowledge and skill to identify areas that require more attention. This will help you create a personalized plan. So as I said, every person is different, so you need to know that what your level is, how much knowledge do you have, and how much you need to put in extra. A lot of knowledge is dangerous as well for MRCPCH as well. If you have a lot of knowledge, that will kill you as well, because in the end, MRCPCH exam, as I mentioned, they want you to be a safe doctor, not a knowledgeable doctor. uh, as working as while working as a registrar, I was working in my previous rotation, I was working in a university level hospital. So as a registrar in emergency, or if a registrar in the ward, I will get take example of emergency, because there is a lot of influx of patients. So working as an emergency, you have, as a registrar, you have 6 or 7 juniors SHOs, which can be F1, which can be F2, or it can be ST1, ST2, ST3 up to year 3. In university hospital, normally year 3 is an SHO, but if it is a DGH, district general hospital, they can be a registrar. So you have 6 to 7 SHOs which you have to supervise, and then on the top there are nurses who will keep on pulling you. So you cannot remember all the pediatrics, and they don't want you to remember all the pediatrics, because they think that every person has different circumstances. They have different level of mentality. They have different situation every day. So if someone is asking me a question, for example, if there is a non-blenching rash patient coming to the emergency, every one of us might have with it 100 of time, but still, if someone is coming to me and he's asking me any question, that what he's going to do, I usually sit with him. We open the protocol. We go through the trust protocol or trust guideline, and we read it, and we decide what we have to do, starting from 1, 2, 3. So MRCPCH exam is not about the knowledge you have; it's about how safe you are. So I always used to tell my student, or always used to tell my candidates, whenever you have a doubt, even if you have 1% doubt, involve your senior. As an SHO, they have to come to registrar to me, and if there is any doubt which I'm worried about, I will go to the consultants. Consultants are not like they used to be in, like, if I consider a consultant in Gulf, I was not allowed to call my consultant out of hour. I will call them, they will become angry with me. But here the things are different. I have to call my consultant because they are being paid for that, and the consultant will themselves tell you that it's your right to call me if you have little bit doubt, because this is what we are paid for. So here the things are different. Consultant will be changing diapers, consultant will be changing wet sheets, consultant will be doing IV line, they will be doing bloods, they will be doing blood gas. So the concept of consultant is different here. The reason to emphasize on this is that many people uh, 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 go and keep on reading about the topic in depth. You don't need to have in depth knowledge of everything. Even in the exam, if you have little bit of doubt and the examiner is asking you question, rather than giving him a wrong answer, if you tell him that, sir, I would like to read about this in detail and I will clarify my worry, he will be much more impressed, rather than if you give him a wrong answer. Similarly, if in communication you have a little bit of doubt and you don't know what the right answer will be, you can clearly tell the role player or the patient or with whoever you are dealing that, uh, I don't know about this at the moment, but I would like to read about it, and I will come back to you with with an answer. And this we most of the time routinely do in our practice. If my SHO feel a patient that which is more challenging for him, or it is difficult for him, which he cannot manage, he tell the patient clearly that I have taken all the details, I have examined your patient, but before give you some answer, or before tell you what my next management plan will be, I would like to discuss with my registrar, or I will bring my registrar and we will speak to you again. If I face some challenging situation where I think that I need to take my consultant opinion or my consultant suggestion, or I need to discuss with my consultant, I tell to the patient on their face. It's not something that it will be considered that I'm not a doctor who don't know anything, but it is like they know that it's something I need to discuss with someone to make sure that I am following the right path, and I'm taking best care of the patient. So I most of the time, if I face any challenging situation where I'm not sure that I have what my next step will be, so I tell them straight away, if you can allow me to just discuss with my consultant and I will get back to you, or I will go through my trust guideline or protocol, and I will tell you that what our next step will be. And it's always encouraged not only by the patients or by the consultant as well, because they know that you are playing safe. About resources, as I said earlier, utilize a range of study material, including textbook, online courses, practice exam. Joining a study group or finding a study partner can also be beneficial. Practice session regularly engage in practical session to simulate exam condition. This can include role player patient scenarios. When you are practicing with someone, practicing as a role player is also studying, because it make you think that what your role player will be asking the question when you are in the exam or when you are practicing with someone. So once you start practicing, and if you are a role player, it doesn't mean that you are not studying anything. Being a role player, it give you a sense that the next question you are going to ask, or when you will be candidate, what the next question you can expect from your role player. So don't think that being a role player is like you are not doing anything. Being a role player, you are learning a lot more than being a candidate, because as a role player you need to adopt your question, and in this way you can when you are in exam situation, you can predict that what next question might come to you, and you will be mentally prepared for that. Try to take mock exam under time condition to build your confidence and improve your time management skill. That is mostly recommended when you are near to the exam, but don't take it so much near to the exam that you are not left with anything. The best time to take a mock exam will be at least a month before the exam, to know your missing bits, and you can further polish your skill. Review and reflect regularly. Review your progress and adjust your study plan as needed. Focus on area where you feel less confident and seek additional support if necessary. And remember, the key to success is consistent and focused preparation. Starting early and maintaining a balanced approach to studying and clinical practice will enhance your chances of passing the MRCPCH clinical exam. Any question or any doubt till now? Any worry from anyone? So, coming to this question, someone was asking that tell how to get a seat. Is it easy to get a seat nowadays? How to apply for clinical exam first time? Like it's same procedure to how we book for theory. So as I mentioned earlier, for theory exam, you have limited number. You have number of seats which comes on first come and first serve basis. So once you open the portal and the time, like for example, it's started 9 a.m. for example UK time, and you open the portal and there are seats, you can book for the seats. But for the MRCPCH clinical exam, the things that are completely different. There is opening period of 24 hours for our seat center. So in this 24 hours you have to apply for the MRCPCH clinical exam. Once you apply for the MRCPCH clinical exam, then they see the application, because the number of seats are limited while the applications are quite a lot. So then they decide that who need to be accommodated and who will be given the priority. So there is a certain criteria which they have to follow to allocate seat. In terms of waiting time in Gulf, it's around 18 to 24 months. You have to wait at least 18 to 24 months in most of the Gulf country till you get a seat. In UK, it's relatively easy to get a seat after completing the theory exam. One of the reason there are a lot of centers in UK. Second, that their exam is run over weeks rather than 2 days. If you see the overseas exam, it will be run over 2 days max, or max 3 days. But for the UK, the exam is run over week time, so they keep on the number of candidates are less as compared to the number of seats, so you can easily get the the placement in UK as compared to Gulf countries or other part of the world. Okay, just 1 minute. So, any specific channel or site for records or watch videos for? So, YouTube is the best place to watch for videos. There is no specific uh, platform where there you can find any video, but YouTube is the best place to watch the videos. You can you will not get exact video what they put in the exam, but still you can get some idea how the videos look like. the main purpose for them to bring video station, previously they used to have videos which used to be like best of five, like they will play video station as a video and they will ask you what the diagnosis, what investigation you do. So it was like a fill in the blanks type station, but they have changed it to two video station. The main reason for that is they want to bring the cases which they cannot bring in real life, like the patient, for example, they are not able to bring in the clinical scenario, or they are not able to bring it because the patient is sick, so they want to introduce that as a video. For video, I will strongly recommend to read all the emergency guidelines in the bedside, pediatric, and the neonatal book, because there's the only book it will help you. Try to make a list of videos which might come up. There are videos are mostly repeated, and if you just read the emergency topics from the pediatric and neonatal guideline, that will be more than enough for you to have a good score in the video. So after clearing MRCPCH, you are coming as a middle grade doctor, which is a registrar. There are certain level SHOs, then registrar, and then consultant. So if you are done with MRCPCH clinical, then you will be coming and working as a registrar here. Yes, Dr. Mazhar, definitely. I can share my details with you. You are more than welcome to ask any question you have about MRCPCH type 3. So iPhone 7 is asking for how long to wait for the seat. So I don't know from which part of the world you are and where you are applying, but the average time, I would say, our seat center is between 18 to 24 months. If you are lucky, you might get within 12 months after passing your all theory papers. But on average, if we talk about the clinical seat, if particularly about the Gulf countries, it is somewhere between 18 to 24 months to have a placement in you in the exam. And as I mentioned earlier as well, so there is like no specific answer to that how many months you need. It depends on what level you are, how much you have done, and how much knowledge do you have about pediatric. But on average, if anyone who is starting for MRCPCH clinical exam, I would always recommend to give at least 6 months, 3 months for getting to know the system, to uh, you getting used to the communication history and the development and video station. Clinical skill I will not talk about, because clinical, every one of us, we are quite good in clinical approaches as compared to the UK candidates, because this is one of the skill that is not being practiced here. They are very good in communication, they are very good in history, and the only thing the UK candidate lack is the approach to the clinical. So I would recommend, if you have some knowledge of pediatrics and you have passed all the theory papers, so 6 months will be more than enough to give for MRCPCH clinical exam. But then the problem is that you don't have any specific time frame that when you will be getting your MRCPCH clinical seat. So the earlier the better. DCH is not a recognized degree in UK. I would not recommend anyone to take any DCH exam, because it is nothing. It's just a diploma, which most of the community nurses or most of the GP who has some interest in pediatric, they usually take. You are not getting any job in DCH after clearing the DCH. It is not considered. It hasn't got any value. So I have not wasted my single penny on it. I would not recommend anyone to waste your money on DCH, because it is nothing, just wastage of money. Yes, if you are working in Pakistan, India, or Bangladesh, where you are doing in private practice, and you want to just write with your name that I am Dr. So and so and I have done DCH UK. So just to give a good impression to your patients, then you are more than welcome to do a DCH, take DCH exam. But if in case you are thinking that it will help you in anything in UK, so it is not at all. It will not help you with anything. It is just a diploma exam which is taken by nurses, or if we here we have advanced child practitioner, which are experienced nurses who take exam and then work as an SHO initially, and then step up to become a registrar. So they usually take it, and then some GPs who have interest in pediatrics, they take the DCH exam just to show that they have interest in pediatric, and they take more of pediatric patient rather than all variety of patient. Apart from that, you need a GMC registration to work in UK, which you can get either through pleb route or you can get through the MRCPCH or Royal College exam route. You cannot get GMC registration through the DCH. So that's my recommendation, my advice, not to waste any money on your on the DCH. Rest is your choice. What about sponsorship and providing evidence of 2-year clinical training in pediatric for appearing in clinical exam? Sponsorship, like you can provide any consultant with whom you have worked, that this is your consultant and you have been working with him. There is nothing like 2 years of clinical training in pediatric for appearing in exam. This is not needed. They will not ask you. It is something which is recommended. It is because that it will help you uh, to know that how you are good and skilled, because it's quite an expensive exam. So if you are appearing in exam without any basic clinical skills of pediatrics, so it is just a wastage of money. So that's one of the reason that they might have included that you need to have pediatric clinical training in pediatric 2 years of pediatric clinical training in appearing in the exam. But it's not a very hard and fast rule, and it's not something which will stop you from getting a seat in the MRCPCH clinical exam. Dr. Maham, there is no any specific book which has been mentioned by the Royal College that is recommended for the MRCPCH clinical exam. Mark BT used to be one of the recommended book, textbook which you people used to follow, but the problem is like it's quite outdated. So I would not personally recommend you going through the Mark Beatty. In fact, I would recommend you going through online resources like MRCP, like Patient Info, what I mentioned. You can go to nice guidelines. You can read about the NHS patient information leaflets. So these are the things which are regularly updated, and like Rebecca used to be followed for communication, but it is quite outdated. It's not been updated recently. So many things are not up to date. So I would not recommend you going and reading about the books. I would strongly recommend reading about around the online resources like patient information and NHS leaflets. Nice. If you are in UK, you can read CKS nice guideline, which is only for UK, and it is quite good. Dr. Sidi, in India also, on average, the waiting time is 12 months. So you might get a seat anywhere around or after 12 months. So it's the average waiting time in India to have a seat in India. Uh, Sorry, someone is asking if we clear for iPhone 7. So as I mentioned earlier, you need to have GMC registration to get a job. To start working here, you need to have GMC registration. And the two option to have a GMC registration is either a Royal College exam, which is MRCPCH for us being a pediatrician, or it's a pleb route. So you need to have complete MRCPCH to have a job here. Without that, you cannot get a GMC registration and you cannot get a job. After completing MRCPCH clinical exam, can overseas candidate get direct entry in the training at which ST, ST3, ST4? So Dr. MHM, there is no requirement of clinical to appear to get into the training. That is one of my slide I had included, but though that's fine. I will answer it now rather than because then I might forget. So there is no specific requirement of MRCPCH clinical exam to get into the training. So basically, the training here is run as a national round 1, round 2, and round 3. So round 1 is basically for ST1, and round 2 and 3 is for entry into ST3 level. There is no more ST4 since the introduction of Progress Plus. There used to be when it used to be an 8-year training program, they used to have ST3 and ST4 uh, uh, seats, but since it's Progress Plus, the training years has been reduced by 1 year, which is now 7 years instead of 8 years. So they have stopped inducting at level ST4. So the max level at which you can get into the training is ST3. So as I mentioned, there is no requirement of MRCPCH clinical to appear in the training. They need you to have theory papers, FOPTAS and AKP to apply for the pediatric training. Yes, you can get into the training from outside. The training window is currently open. I think, if I'm not wrong, 18th of August is the last date to apply for training. You need to sign your pediatric core competencies from a consultant. If he is on the specialty registrar on the GMC, that will be more favorable. But if he or she, whoever your consultant is, who is not on the register for the GMC, then they have to give their proof that they are consultant from their uh, registering body. Like if it is Saudi, so from Saudi Commission of Health Specialty, he need to have a certificate from there that he is a as consultant. Or if he is from the UAE, like they must have certificate from the DHA or HAD or MOH from HAB that he or she is a consultant. Or if it's from Indian Pakistan, so from their medical licensing authority, they must have a certificate that they are a certified consultant. And then you can sign your pediatric core competency and you can apply for your pediatric training. But you need to have a GMC registration to start your job as a pediatric trainee. And for that, then you need either MRCPCH clinical or PLEB. So for applying for training, you doesn't need any clinical, but for starting your training, you do need clinical, because you need to apply for GMC, and to get GMC, you have only two options. So if you are already working as a consultant in Pakistan, how much time should require for clinical? So as I mentioned, if you are working as a consultant, you would have a lot more knowledge than what is actually needed for MRCPCH. As you are working as a consultant, you might have done your FCPS as well, so which means that you might have uh, gone through all the Nelson book quite a few times, and you might be remembering with your fingertips. So you doesn't need knowledge for MRCPCH level as a consultant, but all you need to have skills. And to have that skills, I would recommend at least to give 3 to 4 months so that you can polish your skills. You need good partner with whom you can study your practice your session, like communication, history, and development. Clinical, you doesn't need, because you have seen a lot of clinical patients during your training, but you just need a couple of weeks just to refresh your knowledge or polish your skills. But for you being a consultant, you need 3 to 4 months. But the only thing you need to show in your exam, I would recommend, and I always recommend to whoever is taking course with me and have a lot of knowledge, like people who are coming from India with MD or DMB, or who is coming from India, Pakistan, or Bangladesh with FCPS. They have a lot of knowledge. The only thing they lack is they don't know how to show themselves to be a good or safe doctor. So try to learn that you need to show them that you are a safe doctor, and that can only come with practice. You have to involve your consultant at what level you are working. Even if you are head of department, I can give you a simple example. When I was working in Saudi, my head of department at that time, I was working in the book. I will not say the name of the consultant, but he's currently running courses in Pakistan as well. He failed the MRCPCH clinical exam, I think 5 or 6 times. He was the head of department. He was a consultant in my hospital. Like, you can imagine his level, that how much knowledgeable he was. But he failed MRCPCH clinical exam quite a few times. And when he passed the exam on last the attempt which he did, and he passed the exam, someone told him that when you go this time to the exam, try to go as a student or a candidate. Don't go there as a consultant, or don't go there as a professor, or don't go there as a head of department. Because for them, you are coming to the MRCPCH clinical exam, so you are as a registrar, and they want you to be a safe doctor rather than a knowledgeable doctor. Because, as I mentioned earlier, they don't need your brain, because everywhere, every trust, they have their guidelines, they have their protocols. So whatever you are doing, you can go through the, you can use access the protocol through your mobile, you can access the protocol through the computer. They have access everywhere. they want you to be a safe doctor. If you have a little bit of doubt, go and read the protocol rather than using your brain, which might be tired, which might be stressed, which might be anxious, which might be worried. So they don't want you to miss anything because your brain is tired, or you haven't slept well, or you have driven all the way from your home and it was quite crowded. So knowledge is not what we need for MRCPCH. The only thing we need is to show that how safe you are being a registrar. So MTI thing is totally different thing. MTI, I'm not 100% sure about MTI, but MTI, what my understanding is that it is something, a sponsorship route, which uh, if I talk about Pakistan, because I know about that system much, like if College of Physician and Surgeon of Pakistan, CPSP, which is a college, which is the governing body of Pakistan, who is looking after all the trainings in Pakistan. So if you are in the training program and they sponsor you because they have some commitment with the UK, that they will be sending their trainees for the they will be sending their trainees to know the understanding of the system which is in the UK. So that's what my understanding about MT. I'm not exactly 100% sure what other options are available, but my understanding is that you need to be in some training program in your country which have some commitment or with the UK system or the NHS, which with exchange of the doctors. So that's what my understanding is. I'm not 100% sure about MTI, but if you want, I can read about it and I can let you know about MTI in detail. Dr. Hassan, waiting time, I think Pakistan will get better because the exam has recently started. It used to be one exam, but my understanding is now they are going to two exam, looking at the number of candidates. But still, I know students who has passed exam. It's more than a year, and they are still waiting for the MRCPCH clinical exam placement. So it is, as I said, for India, it is something over 1 year for Pakistan at the moment. But if they increase the diets, like if they do two diets in a year, so that will hopefully bring down the number of the waiting time in Pakistan as well. So for clinical exam, as I mentioned earlier as well, there is no recommended book. All I would recommend to go through patient info, NHS leaflet, NICE guideline, CKS, NICE guideline. These are the things which are up to date and you can easily access from everywhere. I strongly recommend not to go through any book because all the books are all outdated. Now need to go through the notes which people have written for themselves and which has not been updated. I would recommend you make your own notes if you have time. Like if you are planning for your MRCPC clinical for now and you haven't got any placement, you have plenty of time. Or if you have recently passed your theory exam, you have plenty of time. Start making your own notes. It will not only help you and for MRCPC clinical exam, but it will help you in the long term as well. Yes, Dr. Mariam, you can apply for training on the basis of theory exam. And 1 minute, there is any message or no? The website is called Oriel. Let me just have a look, confirm website. So if you go to Oriel website, you can apply from there. Oriel. I will just share the website here. The window for the pediatric ST3 training round 3 is currently open, and anyone can apply who has done their theory parts. But you do need GMC registration if you get training, and if you are starting your training, you need to have your GMC registration to start your training, and for that you need MRCPCH clinical. Let me share the link in the group if anyone want to go and have a look. So currently the MRCPCH, sorry, the ST3 in training window is open for FAP and intake. No, iPhone 7, you don't need GMC registration for training, to apply for training, you need GMC registration to start your training. Yes, I will definitely come to this question. Okay. Number of stations. Yeah. So this is one of the topic I would like to talk about. As I mentioned earlier, it's quite easy to get a placement in UK. But should I opt for the UK center? That's the most important question being asked by most of the candidates. That because every one of us want to finish the exam as quick as possible, because it's hectic exam. It's very difficult to keep on waiting for the exam and getting rejection every now and then. It distracts you. You cannot prepare properly. You cannot plan properly. So many candidates opt for appearing in the UK because it's quite easy to get place in UK. One of the challenging thing, it's logistic issue. Like you might have problem with visa. The visa process might be delayed. I know that some of the people who had their MRCPCH clinical exam, they applied for convocation and their visa got rejection. So there is no surety or there is no confirmation from the Royal College that you will get visa. Visa is your own headache. It is your own problem you have to solve. So once you get your confirmation, you have hardly 2 months in which you have to apply for visa, you have to get your ticket. So these are the logistic issue which you might face in terms of visa, in terms of ticket, in terms of cost of travel, in terms of accommodation, and in terms of the environment. I found UK is quite depressing place in especially in the winter season. It is dark at 5 p.m. here. And if I talk about summer, so it's light, like sunset at around half 9 or 10. So I find it quite depressing when it's winter because life stops at around 5, especially if you are coming from Gulf or if you're coming from other part of the world where there is some balance of environment. So once you come here, you will see that everything is closed at 5, like 5 p.m. seem to be like you are in at midnight. So these are logistic issues which you might face when you are applying for UK center. Language barrier, we all speak English, but it doesn't mean that we understand English as well. When I came, believe me, I have been working in Saudi and UAE for almost couple of years. But when I came here, I had a lot of problem with understanding of the English, the way they speak English. Like I used to see their faces and hardly I will understand anything. I used to ask them to repeat question for me because the way they are speaking, it's quite rapid. You will hardly understand 10% of what they are saying. So language barrier is a problem, especially if you are taking an exam in the periphery, then the language become more and more tougher. It's English, no doubt, but English, the way they speak English is quite different than what we are speaking. uh, I personally had a lot of problem when I start working in NHS. Luckily, I was working in neonatology, so I was not having a lot of parents in interaction because as a registrar, most of my responsibility was to look after the floor. The postnates was covered by the juniors, the SHOs, or if there is any complex counseling, it used to go to the consultant. So most of the time, my duty was to manage the floor, and mostly my interaction was with the nursing team who used to understand and who used to repeat the question for me, and that helped me. But still, when I used to be in the emergency, when I joined my pediatric, you face some people which is really difficult to understand the English, and many times I have asked them, please can you come again. So it doesn't mean that if we are speaking in English, we are good in English, we will be completely understanding the English. So language barrier does come in front of you when you are coming to UK. The most challenging thing is that to know the UK healthcare system. So if in case you are opting to come to the UK, I would recommend to plan properly. start your preparation from 6 months, because once you apply for UK center, there is a 90% possibility that you will be getting a seat. 10% I will still leave a room for, because you never know, there might be a shortage of centers, because in winters, due to logistic issue, they cannot transfer patient, they might reduce some of the centers, and then the number of seats might be less as compared to the number of seats in summer. So still there is 90% possibility that you will get a seat. So what I recommend that, give it at least 6 months. Once you are planning or you have made your mind that you are coming to UK, apply for visa earlier and plan for that. Make your bank balance well, so that you can get a visit visa. You can mention that you are going for the exam and you are planning to stay there to know the health system. Apply for clinical attachments in different hospitals. Without a clinical attachment, passing the exam in UK is a nightmare. You need to have a clinical attachment of at least a month, and if it's 2 months, it's very good. The more the better. The reason to have clinical attachment is that you will see that how people are interacting here, how they are communicating with the patient, how they are dealing with the patient, how patients are interacting with the doctor. In this clinical attachment, you can sit with a consultant in the clinic and you will see how they are approaching to the patient in the clinic and how they are taking history. You will take part in the emergency, and in emergency, when I used to be registrar and I used to have anyone from clinical attachment, for whatever reason, or I used to have medical student, I used to let them take a detailed history from the patient, do the examination, and then I wanted ask them to, like, once you finish, you are done with history and examination, come back to me, we will sit again and we will discuss. So they used to present the case to me, they used to discuss the case to me with me, they used to give me their differential diagnosis, they used to give me their clinical finding, and they used to give me their management plan before I used to go and see the patient, because as a rule, a clinical attachment person or a medical student or F1, F2, they are not allowed to independently deal with the patient. The patient has to go through a registrar before they are sent home. So I used to allow them to take a detailed history, do examination, give their differential, give their management plan, and after that, I used to go with them again and re-explore that if there is anything missing or if I want to add anything to add to the system. So plan your journey ahead, apply for visa, apply for clinical attachment in different hospital. Clinical attachment is a must to have. Apply for the courses here in UK as well. There are different courses which are run in UK, the face-to-face courses, and they are must to have, and they are expensive, of course. Like I think the normal course is like it's something between £500 of a 2 day course, starting to up to £1,500, and still it's difficult to get place, because most of the UK candidates, they will apply for the courses ahead of time. uh, UK trainees or the trainees who are pediatric trainees, they get their course is sponsored, not the full amount, but some of the amount is sponsored, because there is certain amount each year which is given to us by the trust for our courses. Like if I want to do neonatal life support, a pediatric life support, or if I want to do uh, attend any conference, or I want to do any course, like I want to do an echo course, I want to do focus. So there is certain amount which I can use every year as a trainee, and I pay for the course first, and then it's reimbursed to me. My course is sponsored, my vacation is sponsored, my travel is sponsored, and if I eat food and I provide them with a receipt with for that conference, it's sponsored as well. So if you are coming to UK for exam, do look into these course. There's Tunbridgewell course, Evelina course. There are a lot of courses. If anyone is interested, we can share the details of their course as well in the group. So that's must to have if you are coming to UK. The second thing is, the examiner doesn't know that who you are, whether you are coming from Gulf, you are coming from India, you are coming from Pakistan, you are coming from Bangladesh. For them, you are a candidate who is appearing with a UK candidate. So they doesn't know that what your background is. They don't know that whether you are a pediatric trainee or you are not a pediatric trainee. For them, you are someone who is going to be a consultant in the next couple of years, and they are judging you with the candidates who are appearing, who are already in the system and who know the system. So you are being judged as equal to UK candidate because they doesn't know that who you are. So try to come well prepared for the UK exam. Only and only choose the UK exam once you are sure that you have reached to the level that you can compete with the UK candidates. And believe me, you are much better than them if it comes to the clinical examination. The only thing which we lack is the communication, is the history and the development, and that you need to practice. And it is very easy to practice if you continue practicing with some close group, and you usually you use to get you take feedback from someone who knows that how the things are assessed here. So you need to practice with someone who can give you proper feedbacks that how your communication is and what you need to add on to your communication. In communication, you might if I particularly talk about the training communication, if you are, for example, applying for pediatric training, there is one of the session is communication. When I had my training interview, I had anxious mother who brought her child with an allergic reaction, and she thought that her child is going to die. She didn't let me talk for a 1 minute. I would say, like, it was a 10 minute station. When I said good afternoon, my interview was in the afternoon. When I said good afternoon, before I can say anything else, he started bombarding me with a lot of worries. I listened to her properly. I let her finish her speak. When she was done, I said, first, let me introduce myself and let me make sure that you are Mrs. So and so, mother of so and so. And once I did that, it was finished, and then again she bombarded me with a question. The examiner feedback was, I got full marks in that communication. The examiner feedback was, you gave a very good introduction and you were very good listener. So communication is not only communicating with the patient or the role player. It's about how good listener you are. In UK especially, when we had exam recently, we had exam in our hospital where I'm working. So most of the role player, it was the role players were our trainees. So if I compare the trainees, the role player which used to be in Gulf, like, they are mostly either medical student or they are nurses. So comparing the role player of medical student nurses to a role player who is an ST2, ST3, or ST4, who is already in system and who know the system, they make a lot more drama than what other people can do. So you need to be ready for their drama, and you need to be a good listener as well, especially if you are appearing in UK. And in UK, if you don't know anything, and I'm particularly talking about UK because here the examiner, they are judging you with the UK candidates, and they sometimes bring up the scenario. They want to see that how you are responding to the role player. So if the role player is emphasizing on something, or the role player is telling you something, don't get judgmental with them and don't start arguing with them, or don't focus on the point that no, I'm right. If they are saying something, you can politely tell them, yes, I can understand that you have this point, but uh, let me take some time to explain it to you. But if in case you think that she's right, or she's completely focusing on that and she's not listening to you, a role player is not listening to you, just agree with them and arrange a meeting for them with your consultant, and let your consultant deal with uh, that worry she has, or that question she's putting onto you. So in UK, if you are appearing for UK, well, plan well ahead. Give at least of 6 months. Try to apply for clinical attachments. See the system, how the system work here. Get used to the system, get used to the environment. If you come early and you stay here, you will go outside, you will interact with people, and you will improve your language as well, and it will help you understand in the exam as well. So it will help you go through the language barrier which you might be facing in your exam. Okay. So someone was asking about the stations. So there are basically 4 clinical stations, uh, which is with patients. There is one development station which is without patient. There is a role player and then followed by the examiner. So assessment is done by the examiner, who will be your mother, who will be your father, or who will be the examiner, who will be everything. Then there is history, uh, history and management. There are 2 communication and 2 videos. The total marks for the exam are 82, and the pass marks for a face-to-face exam, which is currently running, is 62 out of 82, which is 76.8% of the out of the 100%. I think someone was asking about this question earlier as well. Okay. There's one question. So, Dr. Nandini is asking about examine overseas role player examiners are from UK or from same country. So, wherever the exam is, whether it's in UK or it's in overseas, the examiners are always mixed. So, if it, for example, if it's in overseas center, they will take some examiner from the same center, from the same country, but some of the examiner they will travel from outside as well. So it will be a mix of examiners from the same country and from outside. About role players, they cannot uh, arrange role player. Like, it was even difficult for us when we had this exam here in our hospital. It was difficult for us to arrange role players. So role players are basically from the same place. It will be from most of the time from from the same city, or if its exam is in the hospital, so either it will be the medical student if it's available, or it might be the house officer, it might be the nurses. So role players are from the same place, but examiners are mix or variety of examiner. They will be from the same country and they will be from UK as well. About this exam, the new changes, the exam is domain marking. It's very beautiful system, but problem is some of the examiner, they are not following it. And in this exam, since this has come to the domain system, there is no system of appealing. So we are not no longer allowed to appeal if in case we have any concern or if we have any doubts. Like recently, in this time, the UK exam, it was the most pathetic result, I would say. Many students failed. One of our junior, like, he's like really good. I don't have word to explain that how good he is. Like, he has excellent skills. He is excellent in communication. He is excellent in history. He has worked with me quite a few times, and he has asked my opinion in some patient. And whenever I have been with him in the cubicle with the patient, he has always laid the role. He always used to communicate with the patient. I have only jumped if there is anything I think that they need to be added on, but his communication, his history taking technique, his examination, they were wonderful, but he failed as well. And this is the problem. I think the Royal College has to look into it, like how someone like an examiner can give someone a 0 in communication, unless and until it's like, if you do a blunder, or if you start arguing with the role player, or if you start fighting with the role player, that's something which is different. But if in case it's not something like that, then according to this new system, you are being awarded for everything, like the way you dress, the way you enter, the way you sit, the way you see the patient, the role player, the way you manage your interaction with the patient, the role player, the way you listen to the role player, the way you talk to the role player, the way you change your tone, everything has marks. So how an examiner can give 0 marks to someone in the communication? I think this is something Royal College has to look into, because as a candidate, we have lost the right to apply to complain to the Royal College. But I strongly recommend, one, when you are in exam, in the exam, there will be a chief examiner who is responsible to look after all the system, how the exam is running. Before the exam starts, he will come and sit with you. He will give you instructions, and during the exam, he will be running through the station and seeing. He will not enter in the station, but he will walking around the station just to see how things are going on. If there is anything, any worry which is coming to him, he will solve that. Once the exam is done, then he will come again and he will sit with you. Please, 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 if you think that there is something wrong, if some examiner, by law, the examiners are not allowed to shout on you. They are not allowed to say anything to you. They are only there to mark you. But if in case there is anything which you think is not right, the examiners are not good, they were not listening to you, or there is any concern which make you worried will be affecting your station or affecting your exam, please raise your concern to the chief examiner. Go to him in group, ask. Once your exam is done, they will make you sit in the room, and while the chief examiner is coming, all of you will be sitting in there. It will be like the 12 candidates will be sitting in the room together. Talk to them, group which were with you, like for the history and development, they divide you in two groups, but other communication and history, communication, clinical and video, it is in the same batch, same examiners are there. So if you have concern about any examiner, ask from the colleagues who were with you in the same color scheme, that how their experience was. If in case they are also complaining the same thing, go to the chief examiner in a group and raise your concern. Tell him that this examiner did this and you are concerned, and you will be writing this to the Royal College as well. Once you have raised your concern to the chief examiner, the time you, as soon as you are back from your exam, sit in front of the computer and write an email to the clinical section of the uh, MRCPCH, the Royal College, and tell them that you had this concern about this examiner in this station, so that if in case anything is happening in future, you have a proof that you raise your concern to the chief examiner, you wrote to the Royal College, and you can later on raise your voice, like how someone can give you 0 marks in a video station, or how someone can give you a 0 marks in a communication. And if, for example, you are taking full marks in other communication, so always raise your voice and always go in group. If in case you have raised your concern to chief examiner and you are going to report it to the Royal College, try to take email addresses from your colleagues so that you can write to them together. As if you go in a group, it will have a much better value rather than writing to them alone. Yes, 62 is out of the 82 is the passing marks for the MRCPCH clinical exam. So why, like, if you still study and why you fail, it might not be your day. You still not you're not yet ready for the exam, or you took the exam not prepare well, or you are still not ready for the exam in the way that you need extra time. Don't take the exam prematurely. If you think that you are planning for exam and there is a chance that you will be getting seat, start preparing early, because you get your confirmation from the exam 45 days to be something between 60 to 45 days. So you will get to know that you are going to appear in this station on this exam, in this exam, and it will be hardly within 45 to 60 days bracket. So don't wait for that 45 and 60 days, because 45 and 60 days are nothing to polish you, are enough to polish your skill, but nothing to command to learn all the stations. Start early and start practicing as early as possible. Give at least 6 months and give it a good go, rather than if you stress yourself in 3 months. I have seen candidate passing in 2 months as well. Sorry, someone is. Okay. Yes, sure, Dr. Mariam. I can. You can have no problem. So yeah. So I was talking about, like, when you get confirmation, it's hardly like something between 45 to 60 days, in which you can only polish your skill, but you cannot learn all the stations. So try to start early. Once and only you think that you are ready, go for the exam. If in case you got confirmation and you are not ready for the exam, you can withdraw from the exam. There is nothing which will suffer you, or there is nothing like which will cost you that you withdraw from the exam, because in the new system, you apply for the exam, you are not paying anything. Once you get your confirmation, you get your seat, then they give you a time frame of 7 days, that within these 7 days you have to pay for your exam, otherwise your seat will be withdrawn. So if you think that you are not ready for exam and you applied in haste and you need some extra time, it is your decision you have to make, and you have to see that how ready you are. Don't think that sometimes you think that you are not ready, but you are ready. Like you are practicing for quite a long time, but every time we study for exam, the study will not finish. We feel that we need to study a lot. Exclude that part from there. But if in case you have not studied for a long time and you just start study from 3 months before the exam, and you all of a sudden you are studying slowly and you all of a sudden got confirmation, so there is no need to go for this exam. If in case you are not ready, give at least 6 months, please. If in case you are planning to go to the exam seriously, start your practice at least 6 months. Start with communication in history. That what I used to do. Start with communication in history and look for a group. If in case you are seriously planning for exam, then go to small groups, make it 3 or 4 candidates group, and study on regular basis. Practice communication as much as possible. Practice history as much as possible. Practice with a time. Don't let the time go off. Also about the timer, if the exam, like the communication is 9 minutes, so it is not 9 minutes what we are getting in the exam. uh 9 minutes you are sitting outside, they ring the bell, and then you go inside, you greet the examiner greets you, you give the exam sheet to the examiner, he asks you, sit, you introduce yourself, say hi, hello to the role player, and then you start your communication. So at least 30 to 45 seconds is wasted during this communication or this interaction. So try to practice within 8 minutes. When you are practicing your clinical station with your colleagues, try to finish within at least 1 minute before the usual time, which is what is given in the exam. So candidates usually fail due to inadequate clinical skill. It can be physical examination, failing to perform thorough and systematic physical examination, which most of you are quite good on, but still you need to practice once you are in exam, just to see if you are missing anything. History taking, missing key details are not being structured and gathering in patient history. There is no specific pattern for history. Like people used to say that I have to start with history of present illness, then I have to go to past history, then vaccination, medication, birth history, family history, social. There is no any specific pattern of history. If people tell you, it's all about how you manage your time. Systemic history, also try to go for relevant systemic history. No need to cover everything. Like if it's asthma, if you think that neuro is not relevant to the asthma history, no need to talk about any abnormal jerky movements. No need to talk about urinary incontinence if you think it's not relevant to the system. So try to take focus history. By focus history, we mean that you take the history what is relevant to the patient. Poor communication with patient and family, lacking empathy, clarity, or the ability to explain medical information effectively. So for that, I would strongly recommend read as much patient leaflet as possible. Reading patient leaflet will also give you an idea and understanding of how things are done here. Things might be different, like we don't know, I don't know how lumbar puncture is done in different places in India, Pakistan, for example, and how it's done here. If you read the leaflet, it will give you an idea that how the procedure are done here, which procedure is done under local anesthesia, which procedure is done under the general anesthesia. So if you read the leaflet, it will give you an idea that these procedures are done under this sedation, this procedure are done under this sedation, who is doing the procedure. It will also give you an idea. Always and always involve your consultant if there is any doubt or the role player is not happy with you in the communication, because it will make you a safe doctor, and it will prove that you are always looking for opinion. I have seen here consultant asking opinion from other consultant if in case they are stuck with some case. It's not about that. In some part of the world, it's considered shameful that asking some of your colleagues that how to deal with this patient or how to manage this patient. Some part of the world they consider it is a shame, but it's not a shame here. Here it's considered being a safe doctor. Even if you are a professor and if you ask someone that if you can kindly give me your opinion on this patient, If I talk about my hospital, we have a multi-specialty hospital. So if it's a hematology patient or oncology patient, if a consultant on call is a pediatric gastroenterologist, he will 100% go and take the opinion from the pediatric hematologist if he is going to upgrade the antibiotic or if he is going to change anything. If we are starting someone on antibiotics and if we are in doubt, we call the microbiologist. If we are doing an ECG and if we are in doubt, we refer to pediatric cardiologist and we take their opinion. We send the ECG to them through the email and we call them and we take their opinions. Here things are taken more safer rather than to prove yourself to be more efficient or more knowledgeable. So practice as much as possible. Listen to your role player when you are practicing with your colleague. If you are practicing through the Zoom, try to open your camera and see how you are interacting, because in the exam you will be sitting in the front of the role player, and then your body language and everything matters. So once you are doing practicing, especially when you are close to the exam, try to open your camera and see your patient, see your colleague or whoever is your role player, see and maintain a maintain eye contact with them, and see how you are interacting. In that way you can see that when they are opening their mouth or they are talking something, they are moving their lips, you can take a pause. Rather than practicing without a video, you will not be able to see them talking, and you will interrupt them and you will stop them in between, and it is considered as a bad thing here. So once in the exam also the role player is starting to talk anything, let him finish his talk unless and until it's something rubbish or it's something uh, bullshit which you think will waste your time. So then in that situation you can divert them from that, and you can politely tell them that let's talk about this situation at the moment and we can talk about that later on. So if in case you think that he's completely diverting you from your communication and he's talking about something which is not at all relevant, then you can politely stop them from that thing. And that's also included in the exam, or the role players have been trained that way, just to see that how you respond to the role player if in case they are talking something unnecessary or useless, which is not adding to your communication, but in in fact diverting you and taking you away from the actual topic of the communication. Weak clinical reasoning diagnosis. So inability to interpret clinical finding correctly or to arrive at accurate diagnosis, and management plans failing to propose appropriate and effective management and treatment plan. For that, as I mentioned, if you go to the clinic patient info website and you start reading the topic from patient info, it will really help you, because the way the topic is written, it's the same what we use or we expect someone from when they are taking history or when we are doing the viva. So if you go to the same sign and symptom in the patient info and in topic, it will be more than enough to cover that headings in taking history and the history of present illness and then past medical history. And the management include everything, like include the investigation, include the complication, include the management, the treatment, if there is any referring. Always involve a multidisciplinary team. If in case it is even going to two or three specialty, it's a multidisciplinary team. If you are involving a respiratory nurse, if you are involving an epilepsy nurse, if you are involving a diabetes nurse, this always considered to be a multidisciplinary team. So if in case you think that something is going to be managed by 2 or 3 person, always start with that. You will involve a multidisciplinary team approach, or you will start a multidisciplinary team approach. It will give a better idea of the uh, it will give you a better idea to the examiner that you are thinking broadly and you are involving other specialty rather than doing everything on your own. As I mentioned, doing everything on your own is not considered something safe. Lack of preparation, as I said, so try to give enough time for your preparation. Give at least 6 months. Time management, running out of time before completing tasks such as examination or patient interaction or communication. You are still talking, you are not offering uh, the patient leaflet, you are not summarizing for him. So this is like you are running out of time, and it will come with practice. If you keep on practicing, it will help you overcome this problem. Uh, Try to practice with your colleague as much as possible. Keep the clock with your colleague when who is a role player, or if you have a third person, let them keep the clock so that it will not divert the role player and the candidate. and try to tell them that give you a warning when the 6 minute is done for the communication, for example, or for the history when it's 9 minutes done. So give you the warning and try to stop at exact time, so that the more you will stop on exact time, the more you will polish your skill, and the more you will be good when you are in the exam mode. So always work on the time management. That's the most important thing, because in the exam you're not allowed to have a watch. You might wear the normal watch, not the smart watch, but still it is waste of time. It is diverting your attention. It's like if you look into your watch, it will waste your time, and you might divert your mind, and you might miss some important bits. So it's not recommended to wear anything so which can divert you from the actual task. The only thing which will help you, that the more and more you practice, and the more time you work on the time management. It's a stressful and anxious exam, so high level of stress affecting performance during the exam. When you are in the exam, and if you think that some of the station, like if you are out of a station and you think that it's not as expected, or you didn't do well in that, it didn't go well, please forget that station. It's easy to say, I would say, and difficult to do, but still, if possible, try to practice that. Once you are out of the station, that station is gone, and you still have a lot more to go. If you keep that station in your mind, and you keep on carrying that to the other station, it will only be affecting your other station, and you will be losing marks for other stations. And if you try to practice in a way that once you are out of a station, that station is gone, try to forget it and focus on the other. So there's a possibility that you might perform very good in the other station, and it will overcome the best bit which you have left in the previous station, and will compensate for that. Culture and language barrier, as I mentioned, many people have questioned that if they are appearing in Gulf, so what will happen if the patient is Arabic speaking? It has happened. If in case the patient is Arabic speaking and he's not, you are not able to interact with him, or a patient is not able to interact with him, that's the responsibility of the center, that they will be providing you with the translator or interpreter. And if in case that's the situation, that if the interpreter or translator is used, it will be mentioned in the exam sheet, or the sheet which you are giving to the examiner, that these are the hurdles which were faced during the station. So if in case the role player is from a different language which you are not able to understand, or if you are not able to communicate with them, so the examiners, they are aware of this situation, and there will be definitively an interpreter available for you to interact with the patient, and to help you with the translation. Feedback utilization, ignoring feedback, not addressing weakness identified in previous attempts or practice sessions. So, if you have tried previously and you have failed, or you are taking any course, and someone or some of the mentor, if they give you any feedback, please take it serious. Like, when I was in my last course, I was telling most of the candidates that please always involve your consultants whenever you are taking the exam. You must be much more knowledgeable than when the person who is taking your exam, but it's not about that. You need to prove yourself to a safe doctor, so always involve your a consultant, even if you have a little bit of doubt. Okay. Let's see if there's any question, someone. So, Dr. Saida, if you go to patient leaflet, NHS patient leaflet, or if you, for example, write bronchiolitis, NHS leaflet, it will help you find the leaflet which is written specifically for the for the parents, who can easily understand it. It's in a layman terminology, so you can find anything. If you go to patient NHS patient leaflet, you can find it there, or if you write a topic and write followed by patient leaflet or NHS leaflet, it will take you to that leaflet, and you can read about it. Any question from anyone till now? Recalls are definitely important, but the problem with recall that we don't know exactly what the scenario was, but it is definitely important. It will definitely help you to have an understanding for that what is coming in the exam. I would strongly recommend to write at least like what are the topic which are coming in the exam. If you start writing that, so if I go to CVS station, there will be hardly 9 or 10 topic which will be coming in the CVS. Similarly, if you go to respiratory, there will be hardly 7 or 8 topic which will be coming in the respiratory. So I strongly recommend if you make a list for you and write that what are the topic which you might expect in the CVS, in the respiratory, in the CNS. So it will help you in understanding the in this help you read, and also help you that how much you have covered. Dr. Mazhar, yes, kids is quite useful. We usually follow kids protocol, but I don't know if it's available outside UK or like you are in Ireland, so it might be available there, but I'm not sure if it's available for access to outside of that place. Like if I talk about kids, so we always follow kids if we have a recess call. And sorry, there were messages I missed it. If there is any recess call, so we always put our kids protocol in front of us and we follow that accordingly. So okay, one more question. So this is something about training versus not training. These figures, they are from the it was round 3 of 2023. There were 340 application in total, and the total number of seats were 55. So basically, there are certain steps which you have to follow. There is application window, that's followed by long listing, then there is short listing, then there is interview, then there is offer. So 340 applications were made in 2023 for the ST3 position for a total of 55 seats. In this time in the round 2, it's not yet updated in the RCPCH website, but there were around 600 of application made for a total of 60 seats. And in the end, they called 187 for interview for the 60 seats. So the final ratio for interview per seat was 1 to 10, but initial ratio is almost nowadays 1 to 10. They have to, let's say that they have to allow you for the exam. Most of the patients which are brought in the exam, they are on contractual basis with the centers. They pay them for everything, for transport, for stay, for the day which they are using there. If in case they are not allowing you, either the patient has been stressed out or the patient is tired, there is something which is hurling the examination, then it will be definitely mentioned in your examination sheet that these were the hurdles which were faced during the exam, like how the patient compliance was. So there is a section that how patient compliance was. So if the patient is not compliant, he is not letting you examine, so it's not on your part. The only thing you can do is keep on trying examining him, but still if he's not letting you examine, so you cannot do anything more than that. And then it's the examiner responsibility to mention in the exam sheet the patient was not compliant, and that's it. You He might take his finding, whatever you have found, you can tell the examination finding which you have found till you did your assessment, and he will do the viva with you. But if it is anything on the patient behalf which is affecting your examination, so it will be mentioned in your exam sheet the patient was not compliant, and it will not affect your score or your marks in the exam. So as I mentioned, for ST3 there are 2 rounds, round 2 and round 3. Round 2 basically starts the window opens in July roughly, I would say. And you have to no, sorry, June, July, or yeah, it's no, sorry, 1 minute. Okay, it's not in June, July, it's in November. Round 2 opens in November and the training starts in August. And round 3 it opens in July and the training starts in February. So I was confusing round 2 and round 3. These are the seats which are left over from the trainees. Here sometimes the trainees, they take break from their training to do out of hours, like if they want to do their master, like for example, if someone is planning to apply in some subspecialty, so they need to improve their score in the application, so they take out of hours, they take time out of this, they take time out of the training to do some master degree. If it's female, they might go on maternity leave. Some people withdraw from training as well because they find it quite challenging, because in the training you have to change your hospital, or you are given a specific location, like if I consider myself, I'm training in East Midlands, so there are certain hospital where I will be rotating, but some of the hospital, they might be like uh, more than 1 hour apart from, more than hour and a half from my area where I'm living. So uh, people take go out of the training, they stop doing the training because they find it quite challenging managing the family life and doing the training. So these seats come out when there is some missing bits. Some time the candidates, they do not progress to the ST3 level. They take a pass due to some reason. So these are the seats which are coming. This time now in round two, I think there are 36 seats if I'm not wrong. If you go to RCPCH website and you go to education and examination and you go to ST3, there will be a number of seats given with each uh, locality, like London or KSS, East Midland, West Midland, Manchester. So I think there are 36 number of seats this time in round three. Uh, the window is open, and I think it's going to close on 18th of August, if I'm not wrong. I have not seen into it, but I was just helping a few friends who are preparing for it, just to look into their application and help them in writing their application. So if anyone is interested, they can apply. Apart from that, there are junior clinical fellow, which are basically SHOs, which are non-training jobs. Senior clinical fellow, specialty doctor, specialty registrar. This 2, 3, 4, they are the other names for registrar. Every place they call it in different ways. Some people they call it senior clinical fellow, some they call specialty doctor, some of them call them specialty registrar. So it is the other name of registrar. In term of salary, as an SHO, although you have done MRCPCH and you will be coming as a registrar, but still I would recommend everyone to come as an SHO at least for first 3 months, to know the system, to understand the system, to know the protocols, because there are a lot of challenges which we face. If I talk particularly when I moved to this hospital as a pediatric registrar, the challenge which I faced was safeguarding. The challenge which I faced was like the teenagers coming overdose, the teenagers coming intoxicated. These were the cases which I never dealt with when I was working in UAE, because these are something very different. These were something different for me, and it was quite difficult for me in the start to get used to the system. And I took a while to understand how the safeguarding things work, how to manage with this mental health problem, like uh, eating disorder like anorexia, bulimia nervosa, or you like, if I say like if you are in a shift in 8 hours, definitely you will be seeing someone coming with eating disorder, someone coming with overdose. Paracetamol is the most common medicine or the drug which we usually encounter here, and they might have taken 50 and 60 tablets of paracetamol, and they will not even listen to you, they will not even let you touch them. So it's quite challenging. So I would recommend everyone to come at least for 3 months to work as an SHO, and then step up as a registrar. If you are coming as a registrar, try to make a commitment with the hospital that I'm coming as a registrar, but I need a period of supernumerary or a period of shadowing before I step up to the registrar, so that I can understand the system, I can know the system. If your hospital agrees with you with on these terms and conditions, then your salary remain as a registrar, and they assess you over a period of 2 to 3 months. And when they think that you are ready, they will step you up for a registrar. But please don't come here direct as a registrar. Whatever level of knowledge you have, even if you are head of department, but if you come to UK, the system is completely different. Uh, I don't know in other part of the world, but I have never dealt with safeguarding or accidental overdose we might see, but like these overdoses or these eating disorders or mental health problem, the suicidal ideation, it is quite common here and it's quite challenging. And if you miss anything, it makes a lot of problem for us, and it put us in a lot of trouble. About salary range, it's something £60 a year, £60,000 a year for an SHO, which is before taxes. There are a lot of taxes, and which roughly work out to be £3,750 a month after tax. And for a registrar, it's something around 80,000. It might increase after the recent salary hike if the offer the pay scale which is offered by the government is accepted by the BMA. So if in case it works, so it might go up by 5-6,000 extra, and it will like be 4,000 for an SHO and 5,000 for a registrar. So it is the home tax salary after taxes. If you get a job, you go to UK home salary calculator or UK home tax salary, and if there you can put your total salary, it will work out for you that how much your a monthly salary will be after the tax. Any question? Any question from anyone? Okay. So what the main purpose for our this session was just to, because many of the candidates, they join the course, they join our course, and then they come in the middle of the course sometime, or they join the course and they take the exam prematurely. Please don't take the exam prematurely. The exam is quite expensive. The seat, getting a seat is quite difficult. Always start early. Once you have been made your mind or your focus that you are going to appear in your exam in this time, or you are now more likely to get a seat. Like if I'm waiting for a year for exam and I'm not applying, and then I start making my plan that let's start applying for the exam because now there's a good chance that I will be getting the seat. So once that mind is set, then start practicing early. Give it at least 6 months. Don't take the exam prematurely. None of the courses can guarantee you a pass. This is for sure. If someone claim that their course will help you pass the exam, it's all bullshit. None of the courses can guarantee you pass. We are here to help you master your skills. We are help you to practice with you. We are here to help you, to give you feedback to you. Uh, we are here to correct your mistakes, but you have to work on your part as well. If you will not work, like if you come to the course and you join the course, you attend the session, and then after that you said okay, all job done, so it's not done. You need to find a group, you need to find a partner, you need to practice with them, because it's the practice in the end which will make you perfect. We are always asking our candidates, our students, that whatever problem if you facing, just you are more than welcome to send the message to us in private. You can send the recording to us, and we can help you with that. I remember one of our Dr. Anu. She was working. She was in UK, and she passed in from UK in the first attempt. She used to listen to us. She was working with Dr. Ashna, and both of them passed from in first attempt. One from UK, one from India. They both couple up together. They were practicing together, and they passed in the first attempt. Dr. Anu is currently working as a registrar here, and she's preparing for her training program. She's applying for training this year, and I'm very hopeful that she will get the training as well. The thing which helped her passing her UK exam in the first time, that whatever message she used to take from us, she used to work on that. She used to practice with Dr. Ashna, and both of them used to practice as much as possible together. I don't know if they have any third partner or not, but they used to make a schedule, and they worked really hard in 3 months. And by the time they got confirmation, they had 2 months left, and they really worked hard, and they made it possible that they passed in the first attempt, from one from UK, one from India. So nothing is impossible. The only thing which will help you is that uh, try to practice as much as possible. The more you will practice, the more you will polish your skill, the more you will be ready for the exam. Because in the end, I used to say it's all drama what uh, we used to do. Communication is a drama, and we need to just master that drama, that how we can be in a very good effective in communication, how we can make other person satisfied, how we can be good listener, how we can be sympathetic, how we can be empathetic. So it's in the end like how much you are sympathetic and empathetic to listen to others, and uh, how you can respond to them just to make them satisfied, and make them realize that you are listening to them, you are always here to help them, and you are always here to solve their problem, not that you are here to someone just to listen with one ear and let it go with the other and ignore them. So if it is in practical life, or if it's in the exam, they only want to see that how good you are being a safe doctor rather than a knowledgeable doctor. Any question or any worry from anyone about training? It's free to apply. Anyone can apply if you have done your theory part. Even if you are not ready, problem is the most challenging part in applying for training is the way how you present yourself. The long listing is the most difficult part, followed by shortlisting. Interview, if anyone got interview chance, I'm always here to help you with the interview, and I guarantee you that you will definitely pass your interview in the first attempt. But just make sure that you reach till that point. The most challenging part is writing your application. They ask you to write certain things, and that's the most challenging part. If anyone who has done their theory and who is planning to come to UK and pursue their career here in UK as a pediatric, as a pediatric trainer, to pursue their career, progress their career to become a consultant in UK, start applying for each round. It will not only help you see how they look at your application, but once you are done with your MRCPCH clinical, once you have your GMC registration, you are ready. So it will give you an idea that yes, these were the pitfalls which led you rejection of your application, and which led you to uh, failure of being longlisted or shortlisted. So you can work on that, and once you are in UK, or once you are applying for the next round, you will be much more ready for the application, and you will write it in much more better way, because mostly people face problem in writing that application, which results in failure of getting long listing and short listing. Welcome, Dr. Banumati, Dr. MRCP supervisor for clinical form. Someone don't have any MRCP form. Dr. Saida, you can write anyone's name in that any consultant who you have worked with. There is no any hard and fast rule that you can have to write someone who is a MRCPCH consultant. You can write your supervisor name with whom you are working, and you can give their official email if you have. Email is much more recommended if you have, and it is not really hard and fast rule that you need to have an MRCPCH consultant, because it's not possible in every part that you will have an MRCPCH consultant. What core competencies are important for short and long listing? So, Dr. MHM, you need to sign your pediatric core competency form. If you go to RCPCH website, and if you go to ST3 training, you will find a, a file there. It's a Word file which you can download, and your consultant has to sign that. If he is a GMC and the GMC specialist register, it's very much recommended. But if he is not, then it can be any consultant who has a license of consultant who can give you a copy of that and you can upload with that. So core competency is a form which you have to get signed from your consultant. And important thing for shortlisting and long listing, if you go to the Oriel website and if you open the application, there are different things which you have to write. So you have to go through that uh, it include your clinical skills, it include your research, it include your audit, it include your quality improvement project, it include your leadership and management, it include your statement that what you want to be, what you have done so far in life. So these are seven blocks which you have to fill. Uh, that You can find a detailed one as well in the RCPCH website, or if you just leave your name in the group, I will share all these detail about the training in the group as well in the MedPrep group. You guys can read it, the pediatric core competencies form and the application fill in procedure as well. Yes, Dr. Say that you can write your senior colleague name as well. These are certain links, useful links, which you can follow. Like I was saying, patient info, nice org, CKS nice is not reachable from other part of the world. England NHS, these are the leaflet, patient information leaflets, and nice as well. In MRCPC clinical exam circuit, what is meant development to? Uh, Actually, can you rephrase your question? I didn't get it. Like where it's written development to? No, it's just one development station. Development station is just only one. Uh, if it is something like history and development station, they are the lengthy station in the exam, in the clinical exam. So they are divided into two group. There are two different examiners who are taking development, and there are two different who are taking history. So they divide the candidates in yellow and red, or red and green, some color pattern they give to the exam to the candidates. So yellow will go to the specific examiner for history and development, and red will go to the specific examiner for development and history. So that might be confusing you. There's only one development station, and they have decided divided into two different, like, or there will be different examiner who will be taking development of one group, and there will be different examiner who will be taking development of other, and similar for the history. About other station, the clinicals, the history, the clinical and videos, they are taken by the same examiner for all the candidates. But history and development, there are two different examiner in the exam day, because they want to finish the exam smoothly in a time manner. Okay. A question or anybody from anyone? No problem. You are more than welcome. Everyone is more than welcome to ask any question in the group. If it's about coming to UK, if it's about training, uh, you guys can leave a question in the group. I'm always here to help you in assessing your application. In if you have any problem with any station, if there is any doubt, uh, just if in case I'm not able to reply in timely manner, just that will be the reason that I might be in duty. The problem here in duty is you are not. It's not considered good to use mobile while you are on duty. It's considered quite odd. It means that you are compromising patient safety. You are diverting your mind. So if in case I'm replying late, then don't mind that. Otherwise, I will always reply to you. Other pathways for fields in UK, if in case if the question is regarding career progression to progress to care consultant, then it's a Caesar pathway. There are two pathway. One is joining the formal training of pediatric, which is called National Pediatric Training, and you become a CCT. And the other is a Caesar pathway, in which you give your competencies while working in UK, and your competencies get signed by the consultant, and then they are assessed by the GMC. And when the GMC think that they are appropriate and they are up to the level, then they give you the consultant level. So there are two pathways to become a consultant in UK. Either it will be a CCT or it will be a Caesar pathway. Okay, then thank you so much for your time and attending the session. If you guys have any question, you are more than welcome to try to join the training. Then it's only the national training program. It is ST1 and ST2, ST3, sorry, ST1 and ST3. You can join at ST1 level. But if you have more than 2 years of experience, then you are considered overqualified. But if it's more than 2 years, then you can come and join through the ST3 route and start your training as an ST3. So it's just as a training, there is only pediatric round, national rounds for training. It is ST3. You can join if you have more than 2 years of experience. Okay. Thank you so much, everyone, for attending the session. If you have any question, just I'm always here to answer that. Take care and have a lovely evening. Bye.